Good morning and welcome to our IDA Recovery Kickoff. For a lot of you, you know that this was originally supposed to be our COAD symposium, and then things happened. And we're actually here in this location because we had an open balance from our council 2020 conference, which was then supposed to be our 2021 conference, which then turned virtual. So we've been through a lot, all of us together, in the last 18 months, but I'm certainly glad to be here. But stuff keeps happening. I just don't understand. Somebody told me it was job security. So to introduce myself, if you don't know me, and I think I know everybody in the room and everybody knows me, but I'm Keith Adams, Executive Director of New Jersey VOAD. And first, I would like to introduce you all to the brains of New Jersey VOAD, which is not me, and that is Linda Hardy, who is our disaster resilience coordinator. Who's our disaster resilience associate. So this is our entire staff here. We're very deep in New Jersey VOAD, as you know. But I'd also like to recognize the generous support of our sponsor, the Prudential. And I'd like to thank all of you who said that you would be presenters today, because I know that you had to rush. Again, we changed this event over in about 2 weeks. And I know that we imposed upon all of you to come and present. So I will just apologize in advance if my performance is not stellar today and polished, or our presenters. It's not our fault. We're under a lot of strain and pressure. So we have a full day planned. And I hope that you will each benefit in some way from our presentations, which range from lessons learned from Sandy to many of the major components of recovery. But most importantly, I hope you renew old acquaintances. And I just want to point out that I've been looking around today. You all look a lot older than I remembered you during Sandy. Just say, but you're not. Oh, absolutely. I haven't changed at all. So I hope you also will expand your networks today by not only renewing those old acquaintances, but hopefully meeting someone new. And as it's often been said, if you want to go fast, go alone. But if you want to go far, go together. Well, long-term recovery is just that, long. It's not a short or fast trip, but a far journey. We're just beginning, just starting our work towards a recovery that is equitable, just, and builds resilience. Nonprofits, for-profits, faith-based, and many more will need to come together. We need each other. We need more and many more to join us to help survivors and their communities recover from IDA and become more resilient for future changes. So IDA hit New Jersey on September 2nd, so we're just now 41 days past the storm. And I think it would be helpful to take stock of our situation. These are actually yesterday's numbers. And as you can see, we're a little north of 68,000 registrations for FEMA. And you can also see our crisis cleanup cases. You can see we're starting to eat away from them or at them with our volunteers. And I'm excited, as I announced yesterday, to have our AmeriCorps ADARTs. So that's AmeriCorps disaster response teams that are here on the ground. We have about 70 members that are out there working right now. And we also know that we have some volunteers that are going to join them. I know our OEM staff is also going to join them for a day and add about 50 people to that list. So we're excited that we're going to be able to get through this. One of the things that I noted last night, I got a message from Tennessee VOAD, and they are still trying to accomplish cleanup from the flooding in Waverly, Tennessee. So just to let you know, is that sometimes it feels like we're way behind the eight ball here, but no, we're actually making good progress. I think it's also helpful to know that we're deep in immediate recovery. So we got those activities that I talked about, like cleanup and casework, information and referral. We need to consider where we are emotionally as well. Especially remember that unlike other disasters that we have experienced, We've been struggling with COVID-19 for over 18 months. I'd like to remind you about what's already online to support our recovery here from New Jersey VOAD. And of course, we have the Help NJ Now site, which you can refer folks that want to make cash donations or in-kind donations. And our portal, folks that want to volunteer. And of course, I would point out to all of you as agency representatives, when you need volunteers, please reach out to us so that we can refer them to you. And of course, Client Connect, we're launching that this week. It's actually up and running. We're working out the last bugs, or I should say Linda is working out the last bugs on that to make sure that it is Jersey-centric and will meet our needs. And we'll be onboarding agencies that are doing casework beginning next week. And of course, Compass 82 is taking intakes, providing disaster navigation services. That is their number. It's available to anyone in the affected counties. So if they need help navigating the FEMA process or with their insurance or other disaster-related needs, please refer folks to call that number. And of course, for those that are having difficulty, and we're going to talk a little bit about this, the difficulty that folks are having finding available housing. So a great resource is the Housing Resource Center state. And of course, we provide and continue to add resources to our New Jersey VOAD.org page. That's under member resources, correct? I got the member section. So you are going to be prompted to put in a password, but you'll have access to everything that we have there around it. Okay. So, also the mental health component, I'm sorry. So I think where I really want to start this morning is that Ida is not Sandy. I know many of us have a lot of experience from Sandy recovery, and it seems like just yesterday we stopped. And the truth is just yesterday many of us did. It's only been a little over a year since we actually stopped being involved in Sandy recovery. But I want to talk a little bit about how Ida is not going to be like Sandy. So first of all disasters occur in context. And unlike Sandy, we're not the bright and shiny thing. So Ida left a path of destruction from Louisiana to New York. There are 70 open DRs, or major disaster declarations, in the United States right now. And we're still dealing with a worldwide pandemic. So in Sandy, we had enormous resources at this point, nearly $1 billion, hundreds of thousands of volunteers. In Ida, we will be challenged to embrace opportunities, to be creative and frugal, doing much more with a lot less. Housing is going to be a particular challenge, especially for renters, which make up about 45% of the population in the 12 affected counties. We had only a 3.5% vacancy rate before the storm took tens of thousands of units offline. This will take a concerted effort across all sectors to recover. As we move into long-term recovery, it is important to define what it is. And there's, I think, a pretty good definition. So all those things that occur after immediate recovery, going forward to move folks to what their new normal is going to be. Each community recovering from Ida exists in its own context. Elizabeth isn't Lambertville, or Malka Hill, or Manville. Each community is recovering from the same storm, in some ways the same, but also unique. Like everything we do here at New Jersey VOAD, our efforts supporting recovery will be guided by whole community and asset-based principles. So, whole community, a means by which residents, emergency management practitioners, and organizational and community leaders and government officials can collectively understand and assess the needs of their respective communities and determine the best ways to organize and strengthen their assets, capacities, and interests. And then the asset-based approach focuses on community assets and strengths rather than problems and needs, identifies and mobilizes individual and community assets, skills, and passions. It's community driven, building disaster resilient communities from the inside out. It's relationship driven. We've been capacity building since Superstorm Sandy. We have more robust relationships and resources across the state for disaster recovery. And unlike Sandy and other storms, we have them now. We don't have to spend years forming them. So what's the right way? Well, there is no right or wrong way. It's the way that works for us. So let's talk a little bit about our vision. So this is our vision, not our directive, because as I keep telling you, we're not the boss of you. At New Jersey VOAD, we've adopted incentivized collaboration to guide our work in Ida recovery. Well, what do we mean by that? We think it is essential that our work incentivizes the survivor to fully participate in their household and community's recovery, incentivizes the entire recovery community to focus on survivors' unmet needs and building community resilience, incentivizes local community organizations to create LTRs focused on their neighborhood, community, or regional long-term recovery through collaborative planning, connecting services and resources to survivors' needs, identifying gaps, and advocating for needed resources. That incentivizes regional and statewide solutions of scale to support LTRs with formation, training, and services, like disaster case management, volunteer and donation management, construction solutions, and more. Incentivizes a continuum of care where resource allocation is driven by unmet need. And incentivizes agility, adaptability, and maximizing innovation. We're committed to following the sequence of delivery, incentivizing capturing every dollar survivors are eligible for from insurance and government programs, and making donors' dollars last in. We believe this work should be driven by a common set of core values: commitment to caring, compassion for all people, a respectful, non-judgmental, and non-discriminatory interaction with survivors, community groups, and partner organizations, equitable availability of recovery resources, no matter the survivor's geographic location, race, age, citizenship status, or creed. Intentional outreach to the vulnerable, marginalized, and underserved populations. Trust, mutual respect, and equal partnerships of survivors and community service providers. Integrity is an essential component in helping survivors navigate their recovery. All people have inherent dignity, worth, and autonomy. Human relationships are essential to hope and healing. Folks, this is going to be tough work. We know that from our experience in Sandy and other disasters. This is going to be a long slog. It's going to have moments that are going to bring us great joy and moments that are going to bring us great sadness. It's going to be hard work. So many folks would say, if it's going to be hard work, Keith, why do it? Well, somebody sent me this the other day, and I'm going to share this conclusion of my remarks, but it's a poem by Edgar Albert Guest, and it said it couldn't be done. And I think in a lot of ways over the last few weeks, there's many of us that have thought, gee, I don't know if this can be done. So let me share. Somebody said that it couldn't be done, but I think it was a sharp reply. Maybe it could, but he would be one who wouldn't say so till he tried. So he buckled right in with the trace of a grin. On his face, if he worried, he hid it. He started to sing as he tackled the thing that couldn't be done, and he did it. Somebody scoffed, "Oh, you'll never do that." At least no one has ever done it. But he took off his coat and he took off his hat. And the first thing we knew, he'd begun it. With a lift of his chin and a bit of a grin, without any doubting or quitting. He started to sing as he tackled the thing that couldn't be done, and he did it. There are thousands to tell you it cannot be done. There are thousands to prophesy failure. There are thousands to point out to you one by one the dangers that wait to assail you. But just buckle in with a bit of a grin. Just take off your coat and go to it. Just started to sing as you tackle the thing that cannot be done, and you'll do it. Folks, recovery is a thing that many folks will tell you can't be done. But I think it's worth doing. So I think that we should all buckle in, put on a grin, and get to it, doing that thing that can't be done.